We're here today to demonstrate the application of the Replenix Perfect 10 peel. There's two different products, one for lighter skins, one for darker skins. The peel takes off that layer and it stimulates the growth of collagen and just gives a lovely result. This will just take any makeup and oil off her skin. And we'll go a little bit down the neck. We don't really go too far down the neck. Almost about midway. There you go. Is that too hot?
No, it's good.
Okay. Okay. It does lift up pigment and dry skin, so it will even out tone, improve the clarity, even tighten the skin to some extent. Now, some people with a lot of damage require more than one peel, and these can be done in a series. First step is a wipe that will further degrease her skin. It's important to get as much oil off the skin as we can. It seems like it would be very drying, but it makes the skin penetrable and the product will go in better. It's basically a mixture of acetone, cucumber, and it's designed to strip the skin of oil. So it's fairly harsh. Sometimes I'll have the patient take a deep breath and hold their breath if the fumes are too much, because it does give off some fumes. So go ahead and take a deep breath, Allie. Put the fan on, get those fumes out of here. At this point, we're going to take steps to protect areas of her face that we don't want to peel, particularly the corners of her mouth, around her nostrils and the flare of her nose. And of course, we're not going to get anywhere near the eyes, so I'll touch a little bit of this petroleum product Vaseline around her eyes. Okay, a little on the corners of her mouth. These areas are it's just too delicate to peel and would probably be uncomfortable for her in the next few days. So we just cover that up. A little around, especially the corners of the eyes. We don't want to peel there. And we've even found that it sort of travels and can even travel to the inside of the ear area, so it can be uncomfortable. So I'm just going to run a little line of petroleum along her ear so it doesn't. So the next step is step 2, the peel. This is the active ingredient. This is going to give us our peel. This peel includes 2 active ingredients that are alpha hydroxy acids. There's a lactic acid from sour milk and a salicylic acid from the salix tree. This will be applied evenly for 5 minutes. I'll set the timer and we will begin to apply the layers continuously for 5 minutes. And just apply thin layer that way, down through the T-zone, around the outer part of her eyes. I would probably not advise this on an active acne patient. How does it feel, Allie?
A little bit of hot feeling.
On a scale of 1 to 10, how hot is it?
Just like a 3.
A 3. Any uncomfort above a 6, I would start to deactivate it.
That's great.
We're starting to get a little redness, pink in here, which is what we're looking for. I'd like to get an even pink. Still feeling about a 3, Allie?
A little bit, about a 4, but
Little bit more. We have a fan here. We can help cool it down. See, we're getting a nice, pretty pink. On this third pass, got just enough to do one more pass, and I'm going to pay particular attention to her cheek area where she has a little tiny bit of hyperpigmentation, some freckling going on. As I said, Allie doesn't have much pigment at all. In fact, I like it. It's pretty on her, the freckles, but she expressed a desire to minimize that, so we spend a little extra time there. How's that feel?
Good.
Okay. So the timer's gone off. We've left this on for 5 minutes. It looks really, really good. There is no frosting, as we call it, where you'll get a patch of white. It means you've gone a little too long on that area, but she's really even, no frosting. And so we'll go on to step 3, the neutralizer. And this will just stop the action of the acids and hopefully start to cool any redness or heat down. So we'll just kind of just wipe it evenly across her cheeks. Redness there. Other side. And I'm not wiping all of the petroleum product off yet because we have one more step to go that I want to keep that area protected. How's that feel, Allie? Better?
Much better.
All right. So now we'll go on to step 4. This is the retinol part of the peel. This is another type of a chemical that will help peel. A little bit deeper peel, and oddly enough, it's going to be very soothing on her skin. So again, we've set the timer for 5 minutes, and we will start to apply the retinol product. It's a derivative of vitamin A. It's not quite as strong as the prescription retinols, Retin A, but it's very, very effective agent of peeling. And so we'll just get that down there. How does that feel, Allie?
Good. Really good.
It should feel very soothing.
Yes.
This peel is a great peel for all skin types. We would not want to use it on anyone that was pregnant or lactating. We wouldn't want to use it on anyone undergoing any type of treatments for cancer, anyone with active diabetes, things like that. Probably do not advise it on active acne. If she uses Retin A products, we'd probably ask her to stop those a few days before the peel. When we are done with the procedure, we are going to advise our patient to be extra careful in the sun. Don't want her going outside without some type of very good sunblock on her skin. We advise her not to sit in the sun for, at least a week or so. Avoid extremes of heat. Too vigorous exercise can even cause kind of a reddening of the skin, and sometimes that can cause pigmentation problems. But so just try to keep your skin cool and out of the sun. When it does start to flake, there's a tendency to want to pull at it, and to help the process along, we advise you, please do not peel at the skin. Don't tug at it, don't pull at it. If it's really bothering you and flapping like wallpaper in the wind, you can take a little cuticle scissor and trim it. And that seems to be the best thing to do. It's over in a few days. We will send her home with an aftercare product. It's a very soothing ointment that has a silver ingredient that's very calming and healing. So we'll want her especially the days she's peeling, just to gob up with this stuff. It's not going to look great, but it will help healing and kind of plaster down the flakes so that you're not seeing them in your peripheral vision, and because you will peel. So we'll send that home with her. We have also advised her just carefully wash her skin. Don't stand under the hot shower with water beating on your face. Don't use any type of a washcloth or any sponges. No exfoliants, nothing harsh. So just be super gentle. I always tell them to treat your skin like tissue paper. Always, but especially after this peel. So the timer went off, and she's had this product on for 5 minutes. We are going to lightly remove it. In other words, she'll still have that tacky residue on her skin, but we're going to remove probably a good 80% of it with this last step 5. It's a cleansing pad. We'll just lightly wipe it off, but knowing that there will be a sticky kind of residual, and we'd like her to keep that on for the rest of the day. Tonight she'll probably just wash her face as usual. She may or may not want to use that silver iodine, probably not until she starts to peel, so she can continue with her normal skincare, avoiding any harsh products, Retin-A, things like that. For the first couple of days, you know, if you want to go ahead and wear makeup, it's probably fine. On day 3 and 4, when you're actively peeling, the makeup will not go on very well, and you probably want to avoid wearing makeup those days. We will not put a sunscreen on at this time, but as soon as she removes this tonight, no sunscreen tonight, but tomorrow she'll start wearing a sunscreen. How is that, Allie?
Lovely. Like it.
And that is the Perfect 10 peel.